Now, a lot of our organs have dual innervation. Let's talk about dual innervation. And we'll use two examples. The first is the iris, and the second is the sinoatrial node in the heart. Now, in both cases, there is sympathetic activation through either alpha or beta activity. In the eye, the sympathetic system causes a contraction of the radial muscle and dilation of the iris. Now, it's hard to remember that, so let's think of it this way. The sympathetic system is the system that we use to run away from the saber-toothed tiger as a caveman. So you needed to be able to see far and you needed to be able to see in the dark. So what we wanted to do with our eyes is we wanted to open up the iris so that we could see really, really well. So it makes sense that the radial muscle, which is the spoke-like muscle on the outside of the eye, will contract, opening up the iris, and it also relaxes the ciliary muscle, which is the constrictor muscle of the eye. With respect to the heart, we want a fast heart rate because we're going to be running. So it makes sense that we're going to accelerate the sinoatrial node through the beta-1 receptor. We also will increase the activity of ectopic pacemakers. Now, why would we want that from an evolutionary point of view? That's because in case the SA node fails, we have other ectopic pacemakers that will pick up the job. The opposite of sympathetic activity is parasympathetic activity. Now, in the eye, we act through the M receptors or the muscarinic receptors, causing circular muscle contraction. It also results in iris constriction. So we contract that ciliary muscle to get a smaller pupil. Now, why is that useful? It's because imagine you're a caveman or a cavewoman sitting around the fire and you want to watch ants build a house. You're going to be able to focus on small features, and it's bright day out and you're nice and relaxed. So in the nighttime, you're scared, you're afraid, your eyes have to open up. In the daytime, you're relaxed, you're sitting by the campfire, you're looking at insects, so you need fine vision. In terms of the heart, you have parasympathetic activity in the heart as well. That'll slow down the heart rate. It doesn't really affect the ectopic pacemakers at all, but it does cause a calming effect overall on the heart. Okay. In both cases, the dominant resting tone is parasympathetic. So if you block all nervous input to the eye or to the heart, you're going to result in pupil dilation and tachycardia because the resting tone is always the vagal tone or the parasympathetic tone. Okay, let's have a look at how these different neurotransmitters are made. You have the cholinergic terminal bouton and the noradrenergic terminal bouton. So what's a terminal bouton? Bouton is French for button, and the end of the nerve looks like a button. That's why we call it a terminal bouton. And each case, we manufacture the neurotransmitter within the terminal bouton. I have listed every single possible effector on there so that you can look at it at one glance, but we're just going to focus on one portion at each time.